Your needs. Think service, think your needs. Welcome to the dental domain. What do we do? Unified healthcare, SaaS or cloud tech, all-in-one platform, data security, real-time appointments and payments, AI automation, digital records, robust billing, analytics, multi-platform apps, resource and inventory management, and seamless integration. Patient goes to the reception. Patient lookup is done. If the patient record is already present, then you can select. Otherwise, you can enter in the details and then click on Save. The patient gets added. Then, you can select the service or the staff, select the date of appointment, pick the specialist, and then select the mode of consultation and the time slot and click on Confirm Appointment. This was if the patient record is not already present. Suppose when you do patient lookup, the patient record is already present. When you click on Search Patient, simply select the patient and then do the same. Select the service or the staff, the date, then you can select the mode of consultation, the time slot, and once you are done doing all of this, then you can confirm the appointment as shown. Next, you can also reschedule or cancel the appointments. Let's see how. Select the appointment and click on Reschedule and then Continue. Select the new date and time and click on Reschedule Appointment. To cancel the appointment, select the appointment and click on the Cancel icon as shown. Select the reason for cancellation and then click on Confirm. You can also have video consultation with the patient. Select the service, pick the specialist, the mode of consultation as video consultation and the time slot, and then click on Confirm Appointment. Now the patient does the payment. Once the payment is complete, then the doctor can simply click on video consultation and join the meeting. Once in the meeting, you can move the window to the other side and then fill in the treatment plan simultaneously as you can see. Fill in the symptoms and other details including the vital signs, the chief complaints, the observations, and once all the details have been filled, you can also add attachments before the treatment and after the treatment too. And once the treatment plan is filled, you can save it and then send over the prescription. Now, the patient moves to the nurse who updates the vitals. Click on Update Vital Sign, add in the vital sign and then click on the Save button as shown. Next, you can click on Update Chief Complaints, add in the complaints from the symptoms library, add in description, onset date, severity and notes and then click on the Save button. The chief complaints are updated. Next, you can move the status to different statuses. The status can be changed as per the patient flow. Select the appointment and then you can use the different icons to move back to check-in, to move to in progress, to complete the appointment and so on. Next, during the consultation, the treatment plan is filled. Click on Consultation now and create the consultation. As you can see, now the treatment plan is empty. Past visit summary is shown. Now you can add in the observations, you can add the attachments before and after the treatment, add the diagnosis, and then a special feature is the UI of the tooth structure where you can select a particular tooth that is infected, select the condition, enter in the treatment, and then you can choose from the different views of which part of the tooth is affected and use the numbering to fill in the condition. Once you fill in those details, you can click on Add. You can add multiple records like this. And you can also add notes and images if needed. You can select multiple tooth and add in the conditions as already shown. And the records will be displayed at the bottom, as you will see in a moment. Once you enter in the condition, you can simply select the Add button and the record gets added. Now when you scroll down, you can see that it is populated there. Next, you can add the medicines from the medicine library or you can add in your own medicines. Then you can add in the advices, the attachments after the treatment, tests if necessary, refer to doctor and the next visit. Now, a special feature is a treatment proposal where the dentist proposes the treatment. Here you can also schedule the appointment by using the calendar. Simply select the service type, the mode of consultation and time and date. Appointment gets created directly from the treatment plan page. Isn't that easy? Now for the treatment proposal, you can enter in the proposed treatment, you can enter in the estimated costs, and then how many sittings are required, you can enter it beforehand. We say 2 and we select the dates for the first and the second sitting tentatively, which can be changed later. As you can see, the status is proposed, the amount paid is 0 and the balance amount is 3000. Now you can click on Save to save the treatment plan. Now you can go back to the treatment plan and you can see that it is proposed. Now you can see that all the details are populated. All you have to do is scroll down and then go to the proposed treatments part, and there you can start the treatment. When you click on Start Treatment, as you can see, it says treatment started. Now the status is in progress. You can select which sitting you're doing. You can select multiple sittings at once. You can select the treatment and then the amount that you want to generate the invoice for. And you can then generate the invoice. Click on Generate and Pay. The invoice gets generated. Once the invoice is generated, the amount that is paid will be displayed. As you can see, balance amount is 1500 and paid amount is also 1500. Now you can do the next sitting immediately or you can keep it for the next date. As you can see, it is automatically shown where you can simply click on Edit, scroll down and then you can simply enter the proposed treatment, the sitting and then how much amount is to be paid. Then you can enter in the payment and then generate the invoice. Once the invoice gets generated after the payment is complete, you can click on View Invoice to view all the invoices. You can see both the invoices that were generated, which can be shared through email or WhatsApp or printed. The subtotal, the total amount, all the details are shown. Next, the status is in progress. Now we click on Complete Treatment to complete the treatment. Now you can update and print the prescription. This is how the prescription would look. Now you can see it is complete. You can also predict the treatment plans using AI. Let's see how. When you create the consultation, currently the treatment plan is empty. However, if you go to the diagnosis or the symptoms, first we go to the diagnosis and you click on Predict Treatment Plan, you can see that the medicines, the advice and the tests are automatically populated. Then the patient goes to the reception to pay the consultation fees. If there are tests, then test invoice is generated. Click on Generate and Pay. Once the payment is done, then the patient can go to the lab where the tests will be done. Patient is directed to the lab. Here, the sample details are collected from the patient. Details like sample type, all that is added, and then the test results are entered. We select the template as calcium, enter in the sample, and then enter in the test results and then click on Verified and Save. You can preview the test report. This is how the report would look. You can download, print or share the report through email or WhatsApp. The status changes to reported. Similarly, you can create one more sample. You can collect the blood sample from the customer location and then you can edit the test result. Select the template type from the drop down. We select Complete Blood Count or CBC Enter in all the test results, and once you are done entering in all the test results, you can simply click on Verified and Save. Once it is verified and saved, then you can preview the report, download or share it. This is how the report would look. Now you can select both the reports and create a multi-page report too. You can upload your own reports under the Attachments tab as shown. This is how you create the multi-page report, and this is how the multi-page report would look. Next, the patient goes to the reception, where they are directed to the pharmacy if medicines are prescribed. Enter the prescription. The medicines are automatically loaded. If they are fully available, they are shown in green. If the quantity is less, they are shown in different colors. Click on Proceed, generate the invoice, change the unit price if necessary, and once you generate the invoice, it can be shared through email, WhatsApp, downloaded or printed. That completes the visit. WhatsApp and email updates are constantly sent to the patient regarding appointments, reports, and so on. Thank you for patiently listening.